All right, let's get right into it. If you're a nursing student, you know safety is absolutely everything, on the floor and, of course, on your exams. So think of this as your high-yield review, the must-know safety priorities for the NCLEX and for your actual clinical practice. Let's do this.
Okay, imagine this. You're on the unit, you smell smoke, and then you see flames coming from a client's room. Your heart starts pounding, but panic is just not an option. So what is the absolute #1, very first thing you do? Priority questions just like this are the bread and butter of nursing exams, because in real life, getting this order right, well, it saves lives. Keep your answer in your head as we go through this.
So, here's what's on deck today. We're going to hit 4 critical areas. First, we'll master fire safety with 2 acronyms you have to know: RACE and PASS. Then we'll dive into patient safety, really focusing on fall prevention and the alternatives to restraints. After that, we've got a little infection control masterclass, and we'll finish up by shining a spotlight on 2 super common exam hazards: radiation and C. diff.
First up, fire safety. Look, when a fire breaks out, you don't have time to think. Your actions need to be automatic, and they have to be in the correct order. The 2 mnemonics you see here, RACE and PASS, are basically your lifelines in that moment. Mastering these is, without a doubt, non-negotiable for any nurse.
So, what's our first action? Remember that question from the beginning? Let's answer it with RACE. The R always comes first. Rescue anyone in immediate danger. Your safety is important, for sure, but the client is the absolute priority. Get them out. Only after they are moved to safety do you move on to A, activate the alarm, C, confine the fire by closing doors to stop it from spreading, and then finally E, extinguish. But, and this is a big but, only if it's safe and you're trained to do it.
And if you do get to that E for extinguish, you have to know how to use that fire extinguisher. That's where PASS comes in. It's super simple. P is for pull the pin. A is for aim at the base of the fire, right where it's starting, not up in the flames. S is for squeeze the handle, and the last S is for sweep from side to side across the base. Just remember PASS to actually put the fire out safely.
Okay, let's talk about a few more fire rules that the NCLEX just loves to test. First, and this should be obvious but it's critical, never ever use an elevator in a fire. Also, oxygen is fuel for a fire, so if there's oxygen running, shut it off immediately. And what about that critical patient on a ventilator? Your priority is to disconnect them from the machine and start manually bagging them with an ambu bag until you can get them to a safe place.
All right, let's shift gears now. We're moving from environmental hazards like fire to risks that are centered directly on the patient. And when we talk about this, the name of the game is proactive prevention, especially with falls and the use of restraints. And this slide really nails the modern approach to patient safety. The old way? Just restrain people. But now the priority, the standard of care, is to use alternatives. We've got technology like bed alarms. We use smart strategies like hourly rounding to check on the 5 Ps. That's pain, potty, positioning, possessions, and any problems. Or maybe we move the client closer to us at the nurse's station. Getting family or sitters involved. These are all priority actions you do before you would ever even think about a restraint.
But, what if a restraint is truly the only option left to keep a client from harming themselves? Well, in that case, you have to follow some extremely strict rules. First, you need a specific prescription from a provider, never ever a PRN or as-needed order. You have to use a quick-release knot, and you tie it to the bed frame, not the side rail. And you are constantly, and I mean constantly, performing and documenting skin checks and circulation checks, and taking the device off at regular intervals.
Okay, next up is a topic that is, well, never been more important: infection control. So let's think of this as our little masterclass on how we as nurses break that chain of transmission. This is just core nursing knowledge.
This table right here, this is your ultimate cheat sheet. Seriously. For airborne precautions, we're talking tiny little particles that just hang in the air, like with measles or TB. You need an N95 respirator and a special negative pressure room. For droplet, these are larger particles that travel short distances from a cough or sneeze, like with the flu or mumps. A surgical mask is the key. And finally, for contact, diseases spread by touching, like C. diff or MRSA, it's going to be a gown and gloves every time. You have got to know this table inside and out.
And the foundation for all of this is the idea of standard precautions. This is the golden rule, you guys. It means you have to treat all clients and all of their blood and body fluids as if they are infectious. This isn't about being paranoid. It's about universal safety for you and for every single patient you care for. Now, putting on your PPE is one thing, but taking it off, what we call doffing, is actually where a ton of mistakes happen. This sequence you see here is designed specifically to prevent you from contaminating yourself. The idea is to remove the most contaminated items first. So gloves come off first, then your goggles or face shield, then the gown, and the very last thing you take off is your mask or respirator. This order is so critical.
For our final section, we're going to zoom in on two specific hazards that are super high yield for exams because they require some very specific knowledge. Let's talk about radiation and C. diff.
This slide says it all. If there is only one thing you remember about C. diff, please let it be this. That alcohol-based hand sanitizer that we use all day long, it is completely useless against C. diff spores. It doesn't kill them. You must, I repeat, must use soap and water to physically wash the spores off your hands. This is a massive safety point.
So yeah, C. diff spreads so easily through hand-to-hand contact, which is exactly why that hand washing is so vital. It tends to pop up in clients who've been on antibiotics for a long time, which messes with their normal gut bacteria. And as we just saw in our big table, it requires strict contact precautions. That means you're always putting on a gown and gloves.
Now, let's switch over to radiation. Your safety here really boils down to 3 core principles: time, distance, and shielding. It's simple, right? You want to limit your time in the room, maximize your distance from the radiation source, and always use shielding, like a lead apron. It's a really simple but powerful way to minimize your exposure.
And if you're caring for a client who actually has a radiation implant, the rules get even more specific. They need a private room. You'll wear a little badge called a dosimeter to track your personal exposure. And crucially, if an implant ever falls out, you never ever touch it with your bare hands. And all the linens have to stay in that room until it's safe. These are absolute non-negotiable safety protocols.
So, as we wrap all this up, it really comes back to this one fundamental idea. Whether you're dealing with a fire, a fall risk, an infection, or radiation, your #1 priority is always the client's safety. Every acronym, every precaution, every protocol we've covered is designed to get you ready for that. Just remember that your knowledge, knowing what to do and when to do it, is the most powerful safety tool you will ever have.
And that brings us to our final thought. Let's try to apply what we've talked about. You have a disoriented client, they are constantly trying to get out of bed, they are a huge fall risk, and your hospital has a no restraint policy. What are the first 3 things you do? This question really forces you to think beyond an easy answer and to truly prioritize safety using proactive interventions. So think it over.